Professor Sherry Grace from York University and University Health Network in Toronto, Ontario, Canada, discusses her article entitled Effect of Cardiac Rehabilitation Dose on Mortality and Morbidity, a Systematic Review and Meta-regression Analysis. It will appear in the November 2017 issue of Mayo Clinic Proceedings.
Heart disease is among the leading burdens of disease and disability in the world, and so we can't really cure heart disease. There's a lot of people living with heart disease chronically, and so they're at risk of having another heart event or having a need for a stent or a bypass surgery, for example. And so those patients should get cardiac rehabilitation because we know that that will help reduce their chances of dying and improve their quality of life. So in a cardiac rehab program, patients go to a clinic for some sessions, maybe an hour long or an hour and a half. And during that time, they'll learn about their heart disease, about eating a heart-healthy diet. They get a structured exercise program, and they learn and get support to manage their stress, to quit smoking, and also manage any high blood pressure or high cholesterol. We're kind of among the first to take a look at how much is enough. And some other people have looked at it, but not really in a concerted way. So what we set out to do was to find studies in the literature that have been published where patients got different doses or different number of sessions, but they went to the same rehab program. And then, so we pulled out from those studies the amount of sessions and then the corresponding number of deaths or hospitalizations that they had. We found that patients would need 36 sessions to have significantly fewer stents put in the ensuing few years. So 36 sessions, that's a typical American program. So patients would go 3 times a week over 3 months. We also found suggestion that patients could even have less death with only 12 sessions. In Canada, for example, patients on average get 2 sessions a week over about 5 months. So this is 40 sessions. So in Canada, patients, if they adhere to the full program, would get the recommended dose to achieve these benefits. But in the UK, for example, patients get only about 10 sessions. So they would really need to change and really re-resource their program so that patients could achieve these benefits. If we think about the implications from a patient perspective, I think the findings reiterate the importance that patients get to cardiac rehab.
We hope you found this presentation from the content of Mayo Clinic Proceedings valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.